Good morning and welcome to all of you here in the room at the Mint in glorious but soggy Sydney, and welcome to everyone who has joined us online in the Zoom room to this first hybrid professional standards forum delivered by the councils since we went into lockdown with COVID. It really is a pleasure to be able to see you in person, and looking forward to some wonderful conversations through the forum this morning. Wherever you are joining us from, we are on Aboriginal land. We pay respects to elders past, present and emerging, and acknowledge the long and continuing connection of Aboriginal people to country and to culture. We are joined here in the room and online by members of the Professional Standards Councils, by association representatives, and by the broader professional standards community. Welcome to you all. We have a wonderful panel session to begin today, and we're going to move through a program which has our panel presenting on innovation in complaint systems. We will then open up to conversation both online and in the room before we move into morning tea to enjoy refreshments here in Sydney. I hope you have wonderful refreshments also at home or from your workplace if you're joining online. And then we'll come back together for those that are here in Sydney for a workshop session with Nicole Cullen to explore some of the features of complaint system design and implementation that can drive innovation within your professional standards regulatory arrangements. To begin for this morning, as I said, we have a panel of presenters on complaint systems and how they can support professional associations in delivering professional standards regulation to continuously improve standards of competence and conduct and to deliver consumer protections. Our first panel speaker will be John Vines, the chair of the Professional Standards Councils. John is an engineer by profession and has been leading the Professional Standards Councils as chair, as the senior Victorian member of the councils. John has worked extensively across associations and in regulation in professions, and he will be introducing you to the council's new strategic plan and the position of complaint systems within the regulatory framework under professional standards legislation. He will be followed by Andreas Hager, the CEO of the New South Wales Bar Association. Andreas has a long and distinguished career in the public sector, both in the Commonwealth and the New South Wales public sectors, in departments of Prime Minister and Cabinet and Department of Justice in New South Wales, and is now the CEO of the New South Wales Bar Association. Andreas is going to share with us some of the innovations that the Bar has introduced with co-regulators in New South Wales to eliminate sexual harassment and bullying within the profession. And finally, we will be joined by Dr. Marie Bismarck, a health physician and lawyer who has a long-standing research career at the University of Melbourne, looking at the types of competence and conduct failures that you can identify through the data that professional standards regulators collect through their complaints and notification systems. And Marie is going to share with us some of the features of that data across the legal, the health and the accounting professions to inspire you as to the power of data in being able to deliver innovations in your professional standards regulatory arrangements. So first, let me invite John Vines to take the lectern. John.
Thanks very much, Roxanne, and good morning, everyone. It's great to see so many people here in person today, and also the large number of people that we have on Zoom as well too. So that's great. So in opening the Professional Standards Forum, I'd firstly like to acknowledge the Gadigal people, the traditional custodians of the land on which we meet today, and pay my respects to elders past, present and emerging. For the benefit of new participants in our forums, I'd like to start with a very brief overview of the Professional Standards Councils and Professional Standards Schemes before speaking to the Council's new strategic direction and lastly introducing the theme for today's forum, Innovation in Complaint Systems, and outlining how this supports the operation of the schemes. So what are the Professional Standards Councils? The councils are independent statutory bodies established in each state and territory with powers to approve and supervise schemes for occupational associations which limit the civil liability of association members. Each council consists of a chair, a deputy chair, and members appointed by the minister responsible for the administration of the professional standards legislation in each jurisdiction. And the membership of those, each jurisdictional councils is the same. So that provides for consistency across the nation. So what are the professional standards schemes? Consumers use a variety of services provided by a range of expert advisors. There is generally an expectation that these services will be accessible, affordable and of a high standard. When these expectations are not met, there is further expectation that there will be somewhere for consumers to seek redress. In an article for the Council's Research Library, John Cello, Justine Rogers and Dimity Kingsford Smith helpfully describe these expectations in the concept of professionalism. And professionalism is characterised by professional standards and norms, and vitally, the adherence to those standards and norms. An integral part of maintaining an appropriate level of professionalism is the role of the professional association. As Dr. Justine Rogers and Deborah Harstein record in a report commissioned by the councils on, quote, the value of contemporary professional associations, the work of professional associations directly and indirectly protects consumers of professional services and supports the advancement of a profession as a whole. This protection is clearest in association standard setting and continuing training for competent, productive, ethical and empathetic professional service delivery. It is clear in professional associations work that dealing with consumer complaints and disciplining members is a critical component. To harness the benefits of professionalism, professional standards schemes seek to respond to public risk and prioritise consumer protection, as well as underpin the regulatory authority of professional associations as public interest bodies. The New South Wales Professional Standards Act, in the words of its long title, quote, an act to provide for the limitation of liability of members of occupational associations in certain circumstances and to facilitate improvement in the standards of service provided by these members, it explains the purpose of the legislation. The schemes approved under the legislation are legally binding and require association members to have sufficient insurance or business assets to pay consumers for damages awarded as a result of the members' wrongdoing. In the absence of such a scheme, a defendant's liability could potentially be unlimited. Additionally, the Occupational Association must implement a risk management program, and it must establish mechanisms for dealing with consumer complaints and for disciplining members in respect of complaints made and for breaches of its codes and professional standards. Under a scheme, an occupational association must understand itself to be a regulator of its members' professional conduct and be accountable for its regulatory function to the Professional Standards Councils via annual compliance reporting over the life of the scheme, which is typically 5 years. As we know, schemes have been approved for a range of occupational groups. Professional standards legislation is general in nature in that it may potentially apply to any occupational association, extending the benefits of professionalism to occupational groups that are interested in and have a capacity to participate in the national system of professional standards regulation and delivering overall stronger public benefit. As of 30 June 2022, there were 18 schemes in force nationally, covering more than 93,000 members of occupational associations. I'd now like to turn to the Council's strategic direction. The last 3 years has seen a period of significant productivity for the councils, notwithstanding the impact of COVID-19, and a period of change in direction. And we now have a much stronger focus on engagement with our stakeholder associations. This has been reflected in the success of the forums that we now hold twice a year. And I know that many associations who operate schemes very much appreciate the opportunity to participate in these forums. Other things of note in terms of our direction over the last 3 years are, firstly, there's been a considerable direct involvement of stakeholders in the scheme application redesign project, which produced a new scheme application framework, which is much more user-friendly than the previous version. We have seen a broadening of the range of occupational associations that have had successful scheme applications, especially associations representing the built environment and growing interest from other sectors. There has also been involvement by associations in the recent benefits report produced for the councils by Taylor Fry Consulting Actuaries. The report focused on the effects of schemes on professional indemnity insurance and professional negligence claims and consumer complaints. Favourable trends in the quantum and volume of notifications, insurance claims and complaints against participants of professional standard schemes, with consequent improvements in the cost and availability of professional indemnity insurance, were all linked to the successful operation of professional standard schemes. So in terms of the council's strategic direction going forward, I've touched on an important piece of work that the councils have been involved in recent years, and that is in relation to the broad range of stakeholders in the national system. This was reinforced very strongly during the council's strategic planning process at the end of last year. The key expectation from stakeholders for the period ahead is to see ongoing engagement both with the councils and with the authority. In terms of this engagement, I think the more experienced associations, those with one or more schemes previously approved and a demonstrated regulatory capacity, expect a different approach to engagement, perhaps a lighter touch. Newer entrants to the regime might require closer monitoring and supervision, advice and assistance. Overall, however, our stakeholder associations look to a collaborative approach with the councils and the authority, and they have a reasonable expectation that the requests we make of them will add value to their own activities as well as meeting the statutory obligations. So it's really about working together to achieve outcomes that are mutually beneficial, and the newer associations, especially smaller ones seeking to professionalise, that may be less well-resourced but are committed to raising their members' occupational standards and protecting consumers of their members' services who need support from the authority as we move forward with them towards consideration of their proposed schemes for approval. All of this is by way of introduction to the Council's new Strategy 2025, which is available on the Council's website. So Strategy 2025 was developed by the councils, and we are pleased to present the plan that prioritises the council's activities for the next 3 years. The councils aim that by 2025, the benefits of professional standard schemes will be more widely recognised. We will assist diverse professions and occupations, both established and emerging, to participate in the national system of professional standards regulation and deliver better outcomes for consumers. We want to see that by 2025, the councils are confirmed as trusted and effective regulators. So for the council's 3 strategic goals over the next 3 years, we have 3 strategic goals under Strategy 2025 and 3 strategic initiatives associated with each goal. Goal 1 is to extend professionalisation through professional standard schemes. The outcomes we expect to see here are firstly that the decision makers in government, occupational associations and consumer groups promote and pursue professional standard schemes. Secondly, that associations are using the national system to regulate the professional conduct of their members more effectively, including through innovations in their complaints systems. We also anticipate that there will be a broader range of occupational associations with schemes approved, with increasing numbers of members covered by those schemes, and those schemes and their consumer benefits will be better understood by stakeholders and the community. The second goal is to strengthen the value proposition of professional standards regulation to occupational associations. The outcome here is we expect that participating occupational associations will collaborate to share good practice and knowledge to continually improve their regulatory capacity, consumer protection and occupational standards. As a result, we would expect to see a decrease in the seriousness in consumer complaints and claims, and consequently improving confidence from occupational associations and others who represent consumer interests, including those in government. The third goal is to actively supervise scheme compliance and performance standards and risk management strategies of occupational associations. The councils will continue to monitor compliance with professional standards scheme requirements and publish performance results, including the way occupational risks and consumer harms are treated. We hope to see that improvements in key performance indicators assessed from associations' annual compliance reporting. So, introducing today's forum theme, innovation in the complaints system. As touched on earlier, at the end of 2021, the councils invited representatives of occupational associations, peer regulators, researchers and consumer organisations to provide their views on the priorities of professional standards regulation. A theme that emerged was around the call for clear pathways for complaints and disputes resolution as an important part of consumer protection. The councils were asked to ensure there is a proactive and effective approach to dealing with complaints and achieving constructive outcomes within each scheme. I'm confident that everyone appreciates how critical it is for the association to have effective strategies designed to manage the risk that a member may cause harm to consumers in the provision of professional services. The key function of a complaint system is to resolve disputes as well as help identify professional standards risks and to guide an association's decision-making on controls and mitigation activities with the objective of reducing the risk of harm to consumers. The councils consider an association complaints system to be an essential part of its risk management system, which is a mandatory consideration before approving a scheme. The professional standards legislation provides a model code for complaints and discipline systems, which, from the council's perspective, sets out a minimum standard. The council's assessment of the efficacy of the consumer complaint system helps councils to consider the likely effectiveness of the association's risk management strategies and the means by which those strategies are implemented, which is our statutory obligation. The council's assessment of an association's consumer complaints system focuses on three questions. Does the system address and reduce consumer harm? Does the system improve professional standards? Is the system sufficiently integrated with other required elements of the association's professional risk management strategies to provide reasonable assurance of consumer protection and professional standards improvements? What we're interested in terms of the scheme application process and the scheme's operation are the aspects of an association's systems that are pertinent to a consumer's ability to make a complaint. We want to see practice-focused, input-based evidence of how the complaint system is implemented by an association and outcome-based evidence of its efficacy to protect consumers and continually improve professional standards. This is regardless of whether the association's complaint system is an internal or an external one. Looking from the perspective of a principles-based approach, effective and efficient consumer complaint systems might best be categorised as data-driven, enabling the collection, analysis and reporting of complaints data, such as in the critical area of emerging trends and revisions of the association's risk management strategies. Risk integrated, assisting the association and its members to identify and manage risks in the practice of the occupation. Consumer responsive, ensuring that complainants are not adversely affected by making a complaint, and there is an emphasis on early resolution of complaints and communication. Root cause responsiveness, assisting the association and its members to understand, identify and remediate the root causes of poor practice and consumer harm. Strategic, informing strategies the association may adopt to improve member conformance with professional standards, including whether changes in practice or in professional standards are needed to prevent consumer harm. Educative, informing changes to member practice and behaviour to reduce professional risk together with systems to minimise the escalation of complaints into disputes. Finally, adequately resourced, having the necessary resources assigned by the association to identify and progress improvements. Practical measures showing the effectiveness of consumer complaint systems are vital to demonstrate their success. Such measures could include data on complaints, including root causes of complaints, information on continuous improvement over time, and measures of consumer sentiment and feedback. I'm looking forward to joining you in exploring these features through this panel discussion and the workshop that will follow. In conclusion, Strategy 2025 will build on the outcomes achieved over recent years to enhance our efforts as a rigorous regulator, promoting professional standards improvement and increased consumer protection, and making the national regulatory system robust and easy to deal with. It will also support us to make sure our regulatory system remains responsive into the future, meeting the needs of a broad range of occupational associations committed to leading their members in the delivery of a trustworthy and quality services to Australian consumers. Thank you.
Thank you, John, for setting the scene for us and for introducing the Council's new strategic plan. I will let you know if you're in the room here at the Mint, you have a copy on your tables. We hope you will take that away with you. And for attendees in the Zoom room, we'll pop a link to the plan into the chat function. Speaking of the chat function online, we'd be glad to receive your comments or questions throughout the presentations. We will, at the end of the panel presentations, open up to the floor here in the room and online to address those questions and comments. So please feel very welcome to do that. To take us from theory and the legislation to practice, I'd like to welcome Andreas Haggard to the lectern to present the work of the New South Wales Bar Association. Thank you, Andreas.
So I'd like to firstly start by acknowledging that we are on Gadigal land here in Sydney, and the people joining us are on other First Nations lands across our great nation, and pay my respects to elders past, present and emerging, and extend those respects to any First Nations people who are joining us here today. I'd just like to start quickly by setting the context a little bit for you all about who the Bar Association is. So we are a professional body for practicing barristers and associate members, almost all of whom are either former barristers, either being judges or retired barristers. We have just under 2,500 practicing barristers, and a quarter of those are women and 3/4 are men. In the regulatory landscape, we are co-regulators. Those of you, so we have New South Wales as part of a uniform law jurisdiction, which means the uniform law regulates New South Wales, Victorian and now West Australian practitioners. Under that system, there are designated local regulatory authorities, and the Bar Association or the Bar Council, its council board, which is made up of 21 barristers, is one of these authorities. And we have two key functions under that. The first is our certification function, which is licensing. So we issue practicing certificates for barristers in New South Wales, and we are the sole regulator in that context. And we also handle complaints about breaches of the fairly extensive and comprehensive rules that govern barristers in particular. But we do that as part of a co-regulatory model. And so when we investigate those complaints, those are done under delegation from the New South Wales Legal Services Commissioner. The New South Wales Law Society has a similar function in relation to solicitors. So we have a co-regulatory model, which means not all complaints will be dealt with by us. Some are dealt with by the Commissioner and some are dealt with by us. We also have a couple of other things. I'm conscious I've probably got an hour of content, so I might jump ahead a bit, but I did just want to note there are a couple of other components of our work which really are bent towards professional standards. The ethical guidance scheme is actually a really interesting one, which I won't have time to talk about, but that really enables practitioners who actually have a standards question or an ethical question they can get some guidance from the senior silks on our professional conduct committees, who are our investigating committees of barristers, on what they might do, thus avoiding creating any kind of consumer risk or harm. The other thing, which is actually not on my slide, which should be, is of course CPD, and I'll talk a little bit more about CPD in a minute, but we're fortunate to be not a monopoly provider, but a provider of a significant amount of the CPD content which is consumed by barristers, which is extremely useful in the regulatory exercise. So this is the infographic. So bullying and sexual harassment in the legal profession. I'm not going to spend a huge amount of time on this because I think everybody in the audience is aware of all the work that's gone on, not in the legal profession, but also across many of your professions. This is a problem which has been endemic to most professions for quite a long time. This infographic is from the International Bar Association's survey of legal practitioners. It was done in 2019. It talks about where they have experienced sexual harassment or bullying in the workplace, and the numbers there really speak for themselves. 1 in 2 female respondents had experienced bullying in the workplace, and 1 in 3 men. And with sexual harassment, it's 1 in 3 women and 1 in 14 men. Those numbers speak for themselves, and I won't dwell on them, but it's quite clearly a significant issue from a regulatory perspective. I'm actually going to jump through the next 3 slides really quickly, just to note really here that there has been quite a lot of recognition of the nature of this problem, and also the need to address it, not just in a very strict workplace context, noting that this is conduct which occurs alongside the workplace. And so there were some amendments made to the barristers' rules and some made to the solicitors' rules earlier this year. Those amendments take quite some time. They've been in train for a while. The next slide has the similar amendments actually to federal anti-discrimination and workplace law to really ensure that this kind of conduct is captured and better regulated. One of the other really significant problems about this conduct is that it's not reported. So the 2019 IBA study showed there the number of people who had not reported, and my memory of that study is that these are people who didn't report it to anybody. These are not people who don't report it to the regulator. They're people who don't report it at all. They just experience it and get on with it. And this was borne out by a follow-up study that they did in 2022, this year, I think, which looked at the number of reports received by regulators. And so I think they approached 70 regulators. And this, I think, is an extremely concerning infographic when you look at it, and doubtless some of the people here have experienced this. So this slide shows the number of reports received. It's the first noteworthy thing is that of the 70 that were approached, less than half actually even responded to the survey, which suggests that there isn't possibly even much data on what's being kept. But if you look at it, there were 10 of those regulators who didn't receive any, 12 who had less than 20, and then 3 who had more than 20. So when you're looking at a prevalence, as described in the 2019 stats, and that level of reporting, it's pretty clear that this conduct is not finding its way to the regulator. Why is this a problem? Well, it seems fairly obvious, but in terms of how we go about the regulatory task, a problem like this presents a number of challenges. So this slide here, I'm going to try to unpack a bit for you. There are what I would describe as some traditional mechanisms by way of which we undertake our regulatory task. So the first one is about continuing professional development and standard setting. Many of your professions, definitely including the legal profession, we also set those standards right at entry. So that's the first point at which we can set a clear standard across the board. And then largely we use continuing professional development to drive change where we need to update those standards or highlight particular things. That's what many of your schemes no doubt do. And then if you look at the third limb there, as previously discussed, well, how do we find out what the regulatory risks are? We look at our complaint systems. So it goes without saying then that where you have a regulator that is not receiving complaints of our conduct, which is widespread across a profession, it makes it extremely difficult to undertake that general exercise that you do where you use your complaint systems to identify what the risks are and what your detailed and specific responses might be. In looking at this, I've put there kind of a second limb of work, and this is largely what I'm going to talk to you about today, but I'm going to circle back to the first limb as well, and how the two interact. So the Bar Association commissioned a report from some academics at Griffith, which we now call the Griffith Report, which is not publicly released, but really underpinned a lot of the research and the sort of theory behind a lot of the activities that we have rolled out. And it really looked at how you harness informal reporting and complaints, and also use that to make sure that people or consumers or victims or people who experience this conduct are receiving support. So that's what I'm going to talk to you about now. So we have introduced, and we haven't done this alone, we have introduced a number of measures that are aimed at providing informal ways for people to access support, get information about what their options are under formal complaint handling processes, and also access welfare and support who experience it. I've listed them there, but I'll go through them each in turn. So the first is called SPOT. So SPOT is something, and we didn't come up with this on our own. The Bar of England and Wales was the first to introduce this, and they did it some years ago. So SPOT is an online robot. One of the key things, as you can see from the IBA report, was that there's a huge body of people who don't talk to anybody about it. And so the thinking behind SPOT is essentially that if you don't want to identify to anybody else that something has happened or talk to anybody else about it, there is a robot which you can talk to. And so it really provides two key functions. The first is that you can report conduct and make a contemporaneous time-stamped record of something that has happened. And you don't have to talk to anybody when you're doing that. So you can go on the platform. The robot essentially takes a complainant or a person through what's happened, asking them a series of questions. They can write whatever they want. They can skip questions. And at the end, they can either just save that report, or they can submit that report through to our sexual harassment officer, who I will explain in a minute. So the thinking about that, and I'll unpack this a little bit more too, is that there needs to be a way for us to capture, if we can, what's happening to people who don't really want to talk to us about it. This is particularly important at the bar and for any regulator, frankly, where you are the formal complaints or investigating function, because many of the reasons, and I skipped over this, but one of the reasons why people don't complain is they don't want the consequences of making a complaint, a formal complaint, and all of the stresses of going through that reaped on them. They think it's just easier to ignore it rather than go down that huge process. I'll talk quickly about ELCA, which is actually something which has been rolled out by the Legal Services Commissioner in New South Wales. It's co-funded by the Bar Association, the Law Society, and the OLSC, and it operates slightly differently, but has a similar sort of a model. So ELCA is an online platform for receiving informal complaints, and it also dovetails with a phone service which the Legal Services Commissioner operates. They have, I think, 6 staff who operate that, and it enables people to engage in encrypted anonymous chat if they want through the platform. And for the same reasons that we want to use it, although in a slightly different context, the Legal Services Commissioner will capture the data that's on that made through those informal complaints, and John has indicated that he may use that data to exercise some of his regulatory functions, which can include, for example, investigating a law practice. In addition to SPOT, we've set up an independent sexual harassment officer. This officer is actually independent of the Bar Association, and the report indicated that there were some significant benefits to doing that, really to overcome any concerns that people might have that although we say it's not going to be taken any further, or the information is kind of not going to be used in a disciplinary context, people don't always trust the regulators, So setting up a sexual harassment officer who is independent of us and governed by kind of strict confidentiality requirements really means we can say that anything they say to that sexual harassment officer is not going to make its way back to us, other than in a very high level anonymised form. So that person is not involved in grievance handling, is not involved in investigating complaints. They are there to provide advice and support about pathways. So if people do, what do I do next? What are my options? They can take them through that. Also, they capture all of the data which is on Spot, which means through our Spot platform, people can contact the sexual harassment officer and speak with her if they want to, or they can just submit an anonymous report. She takes that, makes sure that there are no identifying details in it, and then examines that data and provides a quarterly report to us, which identifies trends and themes. And actually, the ELCA platform, I should have said, also does the same thing at a macro level. They have quarterly reporting of trends and themes. I'll just really quickly talk about bar care. So part of what we want to do with these mechanisms is, as I say, enable people who experience this behaviour to access support. So bar care is our EAPS service for the bar. Our sexual harassment officer is also our director of bar care, which means that we have someone who is already trained in trauma-informed approaches to dealing with people in high-stress situations and difficult situations. But also we can connect services. We can connect to services very easily without the need for people to kind of retell the story a number of times, which, when you look at the literature, is a really critical part about supporting victims to make disclosures. So the next thing I wanted to talk quickly about was training. So one of the things that our Griffith report identified is that there were actually informal reporting networks already in existence at the bar. They were essentially senior barristers, most of them senior female barristers, who people just sought advice from. In terms of encouraging informal reporting, it was really important for us to identify that network and then provide them support to take those informal reports and to deal with them in a trauma-informed way. And so we've rolled out some training through PsychSafe, which is Dr. Rebecca Michalak, to those confidants. As we refer them, they're not, we have kept them as an informal mechanism. They're not sort of the formal network of confidants because it's a system that's working well. And they, in turn, can interact with our sexual harassment officer. So we do get some understanding of prevalence without any need for people to be identified in any way. I'll talk about this a little bit with standard setting, but we've also rolled out a lot of training on this for heads of chambers and clerks. But I'll probably talk about that in a minute. One of the things I wanted to mention about the benefits of informal reporting is also the timeliness. So one of the consistent things that have come up in professional standards contexts is the lag that we have with using formal complaint systems. I'm not sure quite how effective all of your systems are, but generally speaking, it takes a couple of years to resolve complaints, particularly complex complaints. And complaints are not normally made immediately following the conduct. And so if you're using your insurance data or you're using your complaint finalisation data, you're really looking at a problem that's actually occurred a few years ago. Now, that data, as others will no doubt talk about in a minute, is extremely helpful in identifying what you should be doing. But there is still a lag there. And one of the great things about informal reporting pathways, particularly for a problem like harassment, bullying and discrimination, is that the data that you're getting is very quick. It's quarterly data. So we know every quarter how many are made. We know, some general circumstances about it, the context of it. And that really enables us to be a lot more responsive, which kind of relates to the first part of that first limb where we're talking about looking at our CPD programs. I did also want to really mention at this juncture that setting up informal pathways is not the answer. It's not going to, in and of itself, stop the behaviour. And that's ultimately what we want to do from a regulatory context, is we want to stop it. So the traditional first limb, and in fact the third limb, as I put it, are still really critical to actually addressing the regulatory problem. With that in mind, the bar last year rolled out a pretty comprehensive CPD program, including a film which was a hard-hitting film about sexual harassment in the legal profession. It used 4 actors that played different roles and the way that different people might experience it. And that film was opened with an address by the then Chief Justice of New South Wales, Tom Bathurst, and closed by the President of the Bar Association at the time, Michael McHugh SC. So I think there are a couple of really important things to note about that in the context of CPD, that standard setting is really important here. And so as effective as and powerful as the actors were in portraying the impacts of this behaviour, having the Chief Justice of New South Wales and the President of the Bar Association make some very direct and strident remarks about the inappropriateness of the conduct is really, really important. We also rolled out a whole bunch of CPDs through on bystander training as well, which again fed through a lot of the work that's happening at the national level, but also through our information coming out of our complaint systems about ways to address the behaviour. And as I said earlier, we are lucky to be not a monopoly provider, but have a very significant share of the market. And although under the uniform law, we are not able to introduce mandatory continuing professional development, we have a pretty significant number of people who attend our CPDs and who attend our conferences. And so when we put in, a conference is a captive audience. So, the conference is what you get, what you go for. And so we can put them in, and we put a sexual harassment, bullying, discrimination CPD in every conference that we ran. And we actually also put one in on family violence, which was another issue identified through the Law Council. The other really critical standard setting thing that we've done is we've updated our best practice guidelines for chambers. So these were introduced originally in 2014, and we have updated them to reflect the changes in the law, but also taken the opportunity to do it as a reset or a reinforcement of that critical message about how important this issue is and the need for us to address it. So at the bottom of that slide, this isn't just limited to harassment, bullying and discrimination. We've also got essentially model workplace. Just talking about respectful relations officers. And so this again has a really powerful standard setting. So under the guidelines, we're requiring each chambers to have a designated person to take complaints. This means that we as a regulator are not the only person who can receive complaints. It also means that every chambers, and we have asked all chambers in New South Wales to consider the updated guidelines, which includes this requirement, and get back to us by the end of October as to whether they'll adopt them. Every chambers to have somebody in chambers who is trained on it, and as I say, able to take those informal complaints and guide people through the various steps that can be undertaken, whether that's right up to the formal complaint to the Legal Services Commissioner or other interim ways of addressing the conduct. And again, on the standard setting, when we launched those, it was really important. We got all of the heads of chambers to come in, and the current and the preceding 2 presidents of the Bar Association. So these are, extremely senior barristers, the leaders of the bar, all stood up and spoke about the importance of it and the need to address the conduct. So there is a really big focus in our work on making sure that we're very clear with the profession about what the standard is and what the expectations are, and also what the regulatory framework is and the big stick that sits behind it. Oh, at the bottom of that slide, we've also introduced guidelines, not just that regulate the chambers, but regulate the Bar Association itself. As a membership organisation, we do also hold social functions, and collegiality is actually a really important thing at the bar, particularly because barristers are sole practitioners and so don't have the supports of an employer like many other professions. Reflections and early results. So how's it going? Well, the informal disclosures are still low. That is an experience which I understand has been quite common with most international examples where these have been set up, including the Bar of England and Wales. They had quite a low uptake initially, and it took a number of years before people started becoming aware of the service and really interacting with the service. Certainly the experience over there is that it has increased quite significantly, sort of around the 3-4 year mark. We're hopeful that will happen again. People are using the system. If they don't actually make a report to us through the Spot platform, we can't tell how many people have used it because it's entirely confidential. But we can tell the traffic that goes to the website for the bar, and the traffic is high and good. So it may be that there are still those people who are using that service and don't want to tell anyone. In my mind, that's not a failure at all. That's good, and it just reiterates that it is okay to have experienced it and to express it and to seek help. And a lot of the conduct that we see when things are made through formal complaints is it takes some time for people who have experienced this to make a complaint. We actually haven't had our quarterly feedback through the ELCA platform yet. John has told me that his experience has been similar. The uptake is not overwhelming, but nevertheless, there is a steady stream, and it is slowly increasing. So we have some very recent data, which we can, I think, take some heart from, that all of this work is doing something, although, as you can see, there is much left to do. So this is our 2022 Practicing Certificate Renewal Survey. So it is 3 months old, which for those of you like me who describe themselves as data nerds, that's great data. We have over 60% response rate, so really high confidence data as well. And this shows that 91% of the profession who responded had not experienced discrimination. 94% in the previous year. This is, so again, you've got to compare your data sets. The earlier data sets was ever. 94% of people have not experienced harassment over the last year. Conversely, that means 6% have. So that number really needs to get to zero before we're going to be declaring victory. And then quite worryingly, 22.5% of the respondents noted that they had experienced bullying in the profession. So our work is not done, and any problem like this, which is so endemic, is going to take a long time. What I would say is, I think, having spent pretty much my entire career thinking about regulatory systems and what's effective, and having done an awful lot of legal policy reform, my reflections on all of that time is that the law ultimately, although extremely important, is words on a page, and the individual decisions that people make as social beings are not extremely influenced by it. There is a huge cultural shift that we're going through at the moment, which I think will be of significant assistance to us. And I think it is beholden on us to take this opportunity, as this cultural change is happening at a societal level, to really press and use all of the regulatory levers that we have at our disposal to ensure that our profession is able to really take advantage of that change and make that change across the board. I think that's it from me. I think I'm probably out of time. Thank you very much.
Andreas, thank you for that insightful and inspiring presentation about what's happening in a very practical sense for the bar and for the legal profession here in New South Wales. I thought some of those reflections around the informal confidants and how they are already an integral part of how the profession understands and hears about these issues was a really important one, and I saw lots of nods around the room in response to those informal pathways being important pathways, but not the solution in and of themselves. So thank you, and we'll now go from the pathways for complaints, formal and informal, to the data that they generate and the insights that data can provide for regulators in determining how to respond to the issues across competence and conduct for a profession. I'm delighted to be able to invite Marie to the lectern to give her presentation.
Good morning. It's wonderful to see everyone here. As Roxanne alluded to when she introduced me, I see the issues of professional regulation through a number of lenses. So I am a very regulated practitioner in that I practice both law and medicine in Australia and New Zealand. So I fill out lots of CPD forms and lots of annual registration forms. So I'm a registered barrister and solicitor in New Zealand and a registered medical practitioner both in Australia and New Zealand. I see regulation through the lens of an organisational leader. So I serve as a company director of a number of organisations, including the Royal Women's Hospital in Melbourne and Somerset Aged Care in New Zealand. We employ many thousands of healthcare providers, and I'm always struck in the difference between our registered and our unregistered workers. So aged care in particular, we employ many registered nurses, but also many aged care providers who are an unregistered workforce. And I see issues of regulation through my role as a legal advisor. I've served as a legal advisor, for example, to the Medical Council of New Zealand, and as a researcher where I've had the privilege of analysing data from 17 professions across 3 countries in New Zealand, Australia, and the United States. So that's a little bit about me. So whenever I look at these lists of most trusted professions, which are put out pretty regularly, I'm struck by how many of the most trusted professions are regulated professions. Some of you may recognise your own profession on that list, and John certainly spoke about the importance of practitioners being worthy of the trust that is placed with them. So regulated professions are highly trusted by the public, and yet you can open a newspaper on any given day and you will see really profound breaches of that trust. In my work as a practitioner, it sometimes feels as though complaints are quite random events, as though at any time a patient or a client might make a complaint about you, and that sometimes complaints can come out of the blue. And yet in my work as an advisor to regulators, it seemed as though the same names were often coming up time and time again. And those of you who work in regulatory roles will be familiar with this phenomenon where you actually begin to recognise the names of these frequent flyers who are incurring, I can see lots of nods around the room, who are incurring multiple complaints. So that was a really interesting paradox for me, this feeling that complaints feel like random events to individuals, but perhaps at a systems level, there might be some patterns. So being a researcher, I thought it would be great to look into that. I looked to some of the work that had been done overseas. Jerry Hickson at Vanderbilt has this wonderful phrase that it doesn't rain on everybody equally. Some practitioners have a malpractice dark cloud. So we put together a multidisciplinary team of researchers to try and find out whether that's true, whether in fact some practitioners are practicing under a cloud. Very grateful to the people who have funded this research over the years, including the National Health and Medical Research Council, the Legal Services Board and Commissioner in Victoria, CPA Australia in Victoria, and AHPRA. And I have to say that Australia is in the wonderful position of having some of the strongest regulatory data sets in the world. So in the health sector, we have 15 professions regulated under a single national umbrella. They have data on, I think it's now close to 700,000 health practitioners in Victoria, New South Wales and other states. The legal services boards and commissioners have fantastic data sets. So it's an incredible opportunity to try and learn from that data and see if some of these patterns do in fact exist. I always believe that it's important to have both the statistics and the stories. So our research has been a mix of quantitative work where we're analysing the numbers and the data, but then also doing more quantitative analysis to tell the stories of members of the public and practitioners who lie behind those numbers. So we began looking at doctors initially. This was really the slide that began to change everything for me. So we found that fewer than 5% of doctors in Australia account for nearly 50% of the patient complaints. Fewer than 5% of doctors account for nearly 50% of patient complaints. And I think that as a regulator, that is a number that should potentially change the entire way that you go about your work as a regulator. We wondered if that was an Australian phenomenon. So we looked to the United States and we found that 1% of physicians in the United States accounted for about a third of the paid medical malpractice claims. So there was certainly that strong clustering that we were seeing in other countries as well. We wondered if this might just be true about the health professions, and we began to look at other professions. And we found that fewer than 5% of lawyers account for nearly 60% of the complaints to the Legal Services Board and Commissioner. And then when we looked to accountants in Victoria, again, a very similar pattern of clustering was evident. Part of my training as a health practitioner has been as a public health physician, and we're always taught that rather than just fishing drowning people out of the stream, somebody needs to walk upstream and find out why people are falling in. So that's really the ethos of public health, that it's really important to be doing the downstream work of addressing problems that have occurred, but somebody in your organisation needs to be walking upstream as well to try and find out why people are falling into the river. So we were really curious about the characteristics of these practitioners who accounted for such a disproportionate share of complaints. We started with some of the easy metrics, so looking at the straightforward demographics. What we found was that male practitioners were consistently overrepresented. And it was interesting that across all complaint types, whether it was about communication or competence or ethics, that male practitioners were overrepresented, but some particular types of complaints were especially gendered. And having just heard Andreas speak, you probably won't be surprised to know that, for example, sexual assault and sexual harassment complaints, over 90% of those complaints relate to male practitioners. We also found that older age was a risk factor across all of the professions. You can see here that there was about a 40% increase in risk for practitioners aged over 65 years compared with their younger peers. We also found that regional practitioners were at increased risk. There are a couple of reasons that might be. I think that in many of the professions, regional practitioners are doing much more general work, that if you're working in a large metropolitan city, you can afford to be super specialised in your practice and therefore develop a real depth of skills and expertise in solving one kind of problem. But many regional practitioners need to be generalists, and so therefore their skills might be spread more thinly. I think that there are consistent concerns across many professions about regional practitioners having collegial support and access to professional development. Hopefully with the pandemic that has begun to change, that so many more events like today's forum are also available in a hybrid format. And then in regional towns, there are often complex relationships with communities that can lead to concerns about conflicts of interest or inappropriate relationships. But actually, by far, the strongest predictor of complaints was the number of previous complaints that a practitioner has had. If you start at year zero with a practitioner who's had a certain number of prior complaints, and then you follow them out for 5 years to see what happens, you can see that if somebody's only ever had one previous complaint, it's about a 40% chance that after 5 years they might incur another complaint. Whereas if you take a practitioner who's already got a track record of having 10 complaints made to a regulator, I can tell you with almost complete certainty that within another 2 years, that practitioner's got about a 95% chance of incurring another complaint. So past behaviour is an incredibly strong predictor of future behaviour. And even among issues that occur very rarely, so as Andreas mentioned, very few people make sexual harassment or sexual assault complaints to a regulator, but among the practitioners who did receive a sexual assault or sexual harassment complaint, about 20% of them would have another complaint of that nature within 5 years. So really high rates of recidivism, even recognising that many of those complaints would not be coming forward to the notice of a regulator. We then began to think about practice type, and here again, some of these patterns were very consistent across all 17 of the registered professions that we looked at, and in particular, professional isolation was a really important risk factor. We could see this most clearly in the legal profession, where the Legal Services Board and Commissioner was able to provide us with great data about the size of the practice that someone works in. So the medical regulators don't actually know how many colleagues a health practitioner has, but the lawyers are able to link information about practice size with individual complaints. And you can see here that the number of complaints was the highest for those who were either sole practitioners or working in very small firms. And as the size of the firm increased, the rate of complaints reduced. Again, we're interested in why that might be, and I think there are a few possible explanations. I think that in and of itself, having colleagues is protective against complaints, that it helps you to make sure that your practice is current. There's somebody keeping a little bit of an eye on what you're doing, that if you're going markedly off track, someone will hopefully let you know. But I think that large firms also have stronger internal complaint processes, and that even if a complaint is made about a practitioner who's working within a large organisation, there may be support within the organisation for that issue to be resolved before it needs to go to the attention of a regulator. But certainly we could see that these sole and isolated practitioners were at increased complaint risk. I do a lot of my clinical work in psychiatry, and I was really struck as I was reading hundreds upon hundreds of disciplinary tribunal reports that there seemed to be some personality characteristics that arose time and time again. This is less scientific than some of my other findings, but this is really just me reading hundreds, if not thousands, of tribunal reports and noticing that there was often a level of defensiveness or hostility or lack of insight or lack of care in the comments made by some of the practitioners who were repeatedly coming before a disciplinary tribunal. So if you think about these sort of big 5 personality characteristics, I think that being conscientious and having an agreeable personality are 2 characteristics that are quite strongly protective against complaints, and for different reasons. I think that if you're a conscientious practitioner, you may be more likely to keep up with your CPD, to be keeping really good records of what you're doing, to be following up on the things that you promised your clients that you would do. It was really quite extraordinary. You know, when I talk about practitioners with a lack of conscientiousness, the level of disorganisation evident in some of these complaints was really quite striking. So, you know, lawyers who were filing their client files in the boot of their car or in their mother-in-law's basement, really quite unorthodox practice arrangements. And then the other personality characteristic was one of agreeableness. And here we often hear people talk in medicine that actually, even if you might not be the most brilliant surgeon technically, if you've got a really good bedside manner, that you'll be less likely to incur patient complaints. And there certainly seems to be some truth to that. And I think that once a patient or a client raises a concern, the practitioners with more agreeable personality characteristics would be more likely to respond in a way that sought to understand and resolve and address those concerns, rather than the practitioners who would respond with a great degree of hostility or arrogance or lack of remorse. Within the health professions, there is an ability for the regulator to reach a voluntary undertaking, which can often avert disciplinary proceedings. And again, we would see the practitioners who were more open and reflective and willing to learn from what had gone wrong would be more likely to actually engage in a voluntary resolution of the matter rather than it needing to go through to formal discipline. And then the 4th quadrant in trying to understand who these highly complaint-prone practitioners was related to what was happening in their life. I love this phrase, a concatenation of personal disruption, that came from a judge in a disciplinary hearing about a highly complaint-prone practitioner, a concatenation of personal disruption. And here we see really how interlinked things are. So, for example, a practitioner may go through a relationship breakdown in their personal life that may then put their own health under stress. They may become depressed or start drinking more than they had previously. That may then impact on their performance at work, which may result in financial difficulties, which then in turn loops back and worsens the relationship difficulties that they're experiencing in their personal life. And so it seems that many of these personal stresses are really quite interrelated. And as we read through these tribunal reports, over half of the highly complaint-prone lawyers were noted to have some form of health impairment. I find it really interesting how different professions respond to health issues. So within the health professions, there's a very clear health pathway where if you have a mental illness or a substance use disorder, you get triaged into a different regulatory response where the focus is really on having an assessment of those health issues and supporting a process of rehabilitation and re-entry into the profession. Whereas certainly at the time that we did this research with the Victorian Legal Services Board and Commissioner, there was no clearly designated health pathway that people who had engaged in negligence, perhaps because they were drinking too much or had a severe depression, would often find themselves going through a disciplinary pathway. And I think it's a real strength within the health professions that they are able to recognise those practitioners where there is a health issue that has been underlying the complaint. John and I were speaking earlier about some of the differences between the New Zealand and the Australian approaches. In Australia, even the practitioners who are in the health pathway can feel as though it's quite an adversarial process at times, where they can, really struggle with their feelings going through that process. Whereas we consistently hear from New Zealand practitioners that they feel as though what the regulator wants is for them to be well and to be able to practice safely. And I think that's such a wonderful thing to be able to aspire to if you are working with practitioners who suffer from a health condition, mental illness, or an addiction, that their sense is that while the regulator is clearly there to protect the public, the way they do that is by supporting the practitioner to return to safe practice if that's possible. Again, just another slide to show how closely interrelated those issues of mental illness, physical health, substance use, and personal stressors can be. But judging by the nods around the room, it seems that this framework seems to be resonating with many of you who are involved in professions outside of the 17 professions that we studied, and hopefully it gives you some greater insights into the characteristics of some of those highly complaint-prone practitioners. And I guess the next question is, well, what do you do about it? Within the health sector, we really love risk scores. So some of you may have been to the GP and had a risk score done to estimate your risk of a heart attack or a stroke or breast cancer. And so what you can do is, once you've got good data on all of these different risk factors, you can put them all together into a risk score, which can estimate the probability of a bad thing happening to a particular person. So we wondered if that might be possible within the regulated professions, whether it might be possible to take all this information we had gathered from the regulator's data and put together some kind of a risk score. And it turns out that it is possible. So we developed something called the PRONE score, which is the predicted risk of a new event. And you can see here that if you take a practitioner who has a PRONE score of 1, so for example, that might be a female physician who's young and has just received her first complaint, there's a less than 15% chance of another complaint within 2 years. So in that instance, the appropriate response from the regulator might be to focus on that individual complaint, to resolve the individual complaint, and to support the practitioner to get on with being probably a very capable and competent practitioner. Whereas if you have a practitioner who's got a PRONE score of 17, so that might be an older male plastic surgeon who's had multiple previous complaints and it's been less than 6 months since their last complaint, they would have a much higher PRONE score with a 90% chance, more than 90% chance of another complaint within the next 2 years. So as a regulator, you might approach that very differently and think that actually your focus in that situation doesn't need to be on just the individual complaint, but actually what you're going to do to intervene with this practitioner to keep the public safe and hopefully try and prevent them from continuing on this trajectory, which is quite likely to lead them eventually having to leave the profession. So you can actually take that data and calculate these scores. When we did this work with the accountants in Victoria, we ran a pilot study where we calculated prone scores for several thousand accountants, and then the CPA in Victoria responded to those practitioners with very, very high prone scores. And I'll always be struck by them telling me a story that one of the practitioners with a very high prone score, who was an older male accountant working in sole practice, they actually went to visit him and said, look, we've been doing this research, we're concerned that you've had some previous complaints and that you're at quite high risk of having another complaint. And the accountant said, I'm so glad that you're here. He said, I am so overwhelmed by my practice. I hardly ever get to see my family anymore. I feel as though I'm drowning and just waiting for the next thing to go wrong. And I'm so glad that you're here. And actually, through that intervention, that accountant was able to move from being in sole practice to moving into a group practice where some younger colleagues could share some of the load. They could have some collegial support, reduce their working hours. And it was just such an incredibly rewarding moment in my research career to think that actually, rather than just responding reactively all the time, that there is an opportunity for regulators to behave more proactively. We've also been really delighted that this research has led to some statutory reforms. So in Victoria, the Health Complaints Commissioners were given new powers that enabled them to look at patterns of complaints rather than just individual complaints. And in response to our findings around the risk for practitioners over the age of 65, there were new policies and regulations put in place requiring doctors who were well beyond retirement age to have regular health checks. So really lovely to see some of this research being translated into legal reform and changes in practice. So what does this mean for all of you in the room? I think the most important takeaway message is that you are sitting on a wealth of information in the data that you hold, and that data can be used both to protect the public, but also to identify practitioners who are on a trajectory to careers of misconduct and hopefully support some of those people back into safe practice. I think that there are really incredible opportunities for regulators to be more proactive, to learn from this data, and to be able to support a more effective and trusted system of regulation. Thank you.
That brings us to a close for our panel session this morning. If you want to dive into the thinking that John and Andreas and Marie have shared with us this morning, the Professional Standards Councils will be producing and publishing short videos of key messages and highlights from the forum, together with the slide presentations and resources that our speakers would like to share with you. So please keep an eye out for information about the publication of those resources soon after we close off the forum today. In the meantime, please join with me to thank our wonderful presenters again for their informative presentations.